afternoon, everybody. I'm very pleased to have the opportunity to speak with you today. When you work for the IAEA, you go to many, many places, but seldom to somewhere as nice as Paris. So I'm very pleased on that account also that I'm here. What I want to do today is to talk to you a little bit, for those who aren't aware, about the IAEA safety standards, about Radon and the international basic safety standards, and what we see as some of the key implementation issues which we still have to deal with. One of the things I'm asked most often is why in God's name the IAEA is doing anything on radon. So let's deal with that myth first. The A in IAEA stands for atomic, not for nuclear. Okay? We have approximately 168 member states. 40 or so are nuclear member states. We spend €100 million every year on technical cooperation, most of which goes to non-nuclear member states. So why radon? Well, it's in the statutes of the IAEA to establish standards, including those for health, but not to do it on our own, to do it with other international organizations, and also to allow for the implementation of those standards. So it's not good enough in the radon area to say you should have a national radon action plan. We have a responsibility also to help our member states implement that. So let's talk a little bit about the IAEA safety standards themselves. They are a unique set of documents compared to every other document from the IAEA because they've got buy-in from member states. Every document, before it appears in print, is sent for a 120-day observation and comment from every IAEA member state. Every comment that comes back has to be dealt with, accepted, and if not accepted, we have to say, why not? So that is not the case with most of the IAEA documents, which all of you would be more aware of. So at the very highest level, we have what we call the safety fundamentals, and these are a very high-level underlying documents. We have then what we call safety requirements, which are shall statements, what you must do to implement the fundamentals. And then we have what we call safety guides, and guides offer you state-of-the-art advice on how to implement the requirements. And as you'll see, the basic safety standards is a requirements document, and we have many, many safety guides underpinning that. We have one safety fundamentals document. We have approximately 14 safety requirements, and safety guides, I think we've about 120 or so. At any one stage, 20 of those may be being updated. So how do we write the safety standards? Well, firstly, we work with ICRP and with UNSCARE. UNSCARE gives us the scientific evaluation of the available information. ICRP outlines the radiation protection philosophy, which all of us use, and based on that, we write safety standards. There's a direct link to ICRP. In 1960, the board of the IAEA said that in the writing of our safety standards, we must follow ICRP to the extent practicable. So that's what we do. So for every ICRP recommendation document, we have an international basic safety standards, and as Emily has just said, the most up-to-date one appeared 6 or 8 weeks ago. Okay. So what are the differences between the European basic safety standards and the international basic safety standards? The first thing is our safety standards are not legally binding on member states, although they are used by many member states as the basis of the radiation protection infrastructure and law. There is a clear link to ICRP. I'm not sure that that's there in the European basic safety standards. We have 190 member states, Europe, at last count, has 28 in the EU. Even the most underdeveloped parts of Europe are highly developed compared to many of the member states we have in Africa and in Asia. Okay? We address our requirements to specific organizations, to central government, to employers, etc., to licensees, whereas the European one assigns it to member states, and it leaves it to the member state how it assigns the responsibilities nationally. And the other thing is we work with the international organizations. As I said, we have 168 member states. The World Health Organization and the ILO have approximately 195. So through working with them, we get outreach to non-IAEA member states. So let's talk a little bit about the basic safety standards. As Emily has already mentioned, the requirement is requirement 50. I'm not going to read it out, but in support of that, we also have a safety guide, which is available online. And we also have a report on national surveys, which is not so well known, but that is also available online. And right now, we're working on many other documents. So what does all of this mean? Well, firstly, let's be clear about the terminology which we use in the IAEA. Because if you read different documents from ICRP, from others, the wording they use is often somewhat different. So when we talk about a national radon strategy, we look at that as a combination of information and an action plan. So we're talking here, I think, about both the action plan and the information to support that. We call that in the IAEA a national radon strategy. So quite clearly it says you should have an action plan if appropriate. It seems to me quite clear that to make that call, you need to have some measurement data. But we also make it quite clear that a measurement program doesn't necessarily mean a national radon survey. For many European countries, it does, but I'm not sure if I go to Indonesia or somewhere like that, that the advice I'd offer them is to do a national radon survey. I think the advice we always give is collect the available information which you have, including information from the Geological Survey, from mining companies, anything that's relevant, collect the data, evaluate it, and see what the likelihood is that you may have radon problems somewhere. And then focus your program on that. It may involve a national radon survey. It may simply involve a regional survey. These have to be dealt with on a case-by-case basis. Okay, so what are the main components of the action plan? Firstly, is to set a reference level for homes, for workplaces. These are the figures in the BSS. We now know the advice from the ICRP is somewhat different, so that's one of the things I expect we'll speak about, that they now set a reference level for the indoor environment and not separately for homes and for workplaces. Identify radon-prone areas. I'll come back to that because I have a few thoughts on it. Implement corrective actions in existing homes, and it has to be a little bit more than just that. Yeah. Come up with and implement building codes for new buildings, and like any plan, implement it and evaluate it. Yeah. And these are not words of wisdom from the IAEA. These come straight from ICRP. Because if you look at what the ICRP says in general about existing exposure situations, it says evaluate the exposure. When, where, and how are people exposed? That's your measurement campaign. Identify the actions. Select the best action, prioritizing the protection of those who receive the highest exposures. I'm not sure in the radon context that's what we really want to be doing, and that's something I think we also need to think about in the next few days. Implement the actions, evaluate the effectiveness, and very importantly, something it says in the same document, as time goes by, greater attention is given to preventing exposure rather than mitigation, which is actually contradictory to the third point, that you focus on those who receive the highest radiation doses. But that's something we'll come back to. So, National Radon Strategy. Firstly, information, whether or not there's an action plan. Measurements to decide if you need an action plan. If you have an action plan, you establish it, you implement it, you review and update it, and that's what it says in the safety standards of the IAEA with regards to radon action plans. So now let's talk about some of the key implementation issues. Some of you will be aware that at the start of this year, we set up a European regional project on radon supported by Department of Technical Cooperation. There are 32 member states entitled to be involved in that. 31 are involved. That, in terms of agency, is unheard of. We normally expect 12 countries, 14 countries. 31 of 32 eligible member states are working with the agency on radon. And what's really important for this meeting is that 14 of those are existing EU member states, and 4 of them are candidate countries. And they come to the agency for help, and not to anybody else. So, knowing we were going to meet here this week, we asked them, what do they see as the challenges they have, and why have they done nothing on radon so far? And the first thing they said is the coordination issues at home. The 3 groups which we all know need to be involved: radiation protection, health, and the building industry. They speak different languages. They don't deal with each other on a routine basis. Basically, the radiation protection people said, we don't know people in the Ministry for Housing, so how can we work with them? We don't see it as a shared interest and responsibility. Okay? We underestimate the radon risks. The smoking I want to come back to in the next slide. The program is a long-term program, and it's difficult to know how you measure effectiveness. Are you really going to see a reduction in the lung cancers? And these are important issues for ministers. Okay? They need to be able to say they've spent money and it's been effective. And it's not clear how we can measure that in radon. Also, from the member states, they said to us they need more visibility from the international organizations in this. That includes the World Health Organization and the IAEA. And also, it's not, as somebody mentioned earlier, radon is not known in the other government ministries that have to be involved. And the third main point they made was resources. There is no regulatory body or no Minister for Health who has so much money that they can start a radon program without taking money from somewhere else. And that's always difficult. And for countries starting off, they lack the expertise to set up. They may have some experts to measure, but they have no policy people with radon, so they don't start. Okay? From the agency's viewpoint, we know how to measure radon. We know how to build new homes with low radon concentrations. We know how to apply corrective measures. At least we do in Europe and North America. When we go outside those areas, I'm not sure that's the case. But that's not a concern for all of you here. What we see are the real challenges are communication and policy development and implementation. And I haven't yet spoken to any regulatory body who didn't know deep down they should be doing something about radon, but they're not. And the reason is very simple. It's a Pandora's box. They know when they open it up, something's going to jump out. They don't know what, but they really don't want to find out because there's nobody there to help them, and you can't put that lid back on again once the box has been opened up. But now we have the agency. We're working with the World Health Organization. Just to give you an example, apart from the European work we're doing, we have separate outreach to the Russian Federation, China, Brazil, Cameroon, Iran, Serbia, who have all come knocking on the agency's door because it's in the basic safety standards saying we have a problem with radon. We've always known we have a problem with radon. We now want to do something about it, and we want your help to do it. So that's the situation we're in. So what do my team think are some of the key issues we should be looking at this week? I think, what is the balance between the state's role and the individual's role? And this will change between member states. The structure of the country, the regulatory infrastructure is different, but this is something I think we need to look at. Yeah? Radon-prone areas, we define them, but do we maximize them in terms of how we use them? Yeah? Risks to non-smokers. This is, Emily and I have discussed this in the past. The message we give is that the majority of lung cancers from radon will be seen in smokers. That's another way of saying radon is not a risk for non-smokers. If that's the case, we should say so. If it's not the case, we should change the message. And if the message is targeted at smokers, I think we're wasting our time, because they're sick and tired of being told they're killing themselves. If radon is doing it also, they really couldn't care less. Cigarettes are doing it more so than radon is. So I think we need to think clearly about the messages linking radon and cigarettes. Okay? Building professionals. Architects and engineers learn about damp proofing, energy efficiency, but I don't think they learn about radon in university. Maybe it's about time they did. And the other issue, of course, is should we give more attention to future housing, given the problems there are in identifying existing homes with high concentrations and fixing them, and as Emily has said, the cost of all of this. And this is a collective dose argument. And in other areas we say collective dose shouldn't be used for these low doses. We don't believe in it. It's not the right thing to do. But here, when it suits us, we use it. So let's discuss that, and let's be clear. Should we be putting more effort into reducing the collective radiation burden by putting more emphasis on existing homes and perhaps a little less emphasis on new homes and a little less emphasis on existing homes, or maybe leaving those sorts of decisions not to government but to the individuals? Thank you, Chair.